Welcome once again to the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. In the midst of the COVID-19 pandemic, we continue to see the effects of this deadly disease as it ravages through our communities. At this point, we are in the middle of April 2021, and many Guyanese at home and abroad have been touched directly and indirectly by this deadly pandemic. We'll continue our conversations about this. As usual, I'm starting off this program wearing my mask to cover both my nose and mouth, but I'll take it off now using the straps around my ears. There's no one close to me that I can put at risk, and therefore, myself, I am not being put at risk by anyone who is close to me. Remember, the recommended distance for social distancing is a minimum of 6 feet from people, especially those not in your usual social circle. The other recommended things to practice include hand sanitization, washing of your hands as often as possible, as well as wearing your mask. As we speak now, Guyana would have vaccinated almost 70,000 persons within our borders. That's 70,000. And I believe we would now be probably the #1 nation in the CARICOM group of countries for vaccination of its citizens. And that's an amazing achievement, bearing in mind that we started out our vaccination program after our friends in Barbados and a couple of other countries. And so we're very grateful to be at this stage right now. In fact, our vaccination grouping has changed significantly since we started. Remember, we started out vaccinating healthcare workers first. Those are the frontline people like myself. Our next group included the elderly persons greater than 60 and 70, and then we eventually brought it down to 40. And now we are at a point where every adult that's 18 years and older can take the vaccine that are available. And these vaccines include the AstraZeneca vaccine, the Sputnik vaccine from Russia, and the Sinopharm vaccine from China. 18 years and above in Guyana are now eligible to take these vaccines, any one of them. And the best vaccine to take is the one that you have right in front of you. It doesn't matter the maker, the name, the type. The best vaccine for you to get at this point is the one that you have available. Because what these vaccines do is that they prevent you from becoming severely ill from COVID. Severely ill meaning that you are prevented from being admitted to the ICU, being put on a ventilator, or even dying from COVID. And that is the main benefit across all of the vaccines that we have available. They prevent severe COVID-19 infection, and that's 100% effective regardless of which type of vaccine you take. 100%. You may still get COVID, but it's only going to be a mild COVID with minimum symptoms, and you will not become severely ill and not be admitted to hospital in ICU settings. But you still need to wear your mask, you still need to social distance, you still need to sanitize, because even though you may not be admitted to hospital in a severely ill condition, you may still pick up the infection and you can transmit it to persons who are vulnerable and those who are not vaccinated. When I say vulnerable, I mean the elderly patients in particular, people who are cancer survivors or suffering from underlying conditions like diabetes, high blood pressure, kidney disease, obesity, etc. These are all things that put people at increased risk for bad outcomes when they get COVID. So part of the fight against COVID-19 is not just to take your vaccine, but to protect those around you as well by practicing these safety measures and following these guidelines. Now we have in Guyana over 11,000 persons testing positive for COVID-19, and we have passed 250 deaths that are related to COVID-19 infection. These are unfortunate milestones that we have reached, and we have to continue with our efforts, continue with the fight to make sure that we beat this pandemic, or we beat the effect that it has locally. It is not just up to the healthcare workers, but it is up to all of us. Healthcare workers can only do so much, but they can't do everything. The enforcement officers can only do so much. They can't do everything. They can't be in every street corner to prevent gatherings. They can't be in every bar. They can't be walking the streets all the time to ensure everybody wear their masks, sanitize, and maintain social distancing. So it is up to the population, it is up to us to know the right things, but not only to know the right things, but to do the right things. And these are quite simple, and it requires not a lot of effort, not a lot of discipline, but just to practice safe things, to be able to do these things routinely and regularly that have become part of your habits. So I hope that would have helped you to understand the seriousness of the situation that we are in. To have any condition claiming the lives of more than 250 people, it's something very, very significant, especially if you have more than 11,000 of your citizens becoming infected already with this deadly virus. So it is up to all of us to do our parts to maintain a safe and healthy population and to reduce the adverse consequences or outcomes from this deadly infection. So we can all do our parts. Remember, when you go into places of business and all these other areas, you should check your temperatures before you go in. Business places and all other establishments have put these measures in place. A lot of them have sinks or areas where you can sanitize your hands before you get into the places of business. A lot of them would have spent money to create those kind of infrastructure for people to actually practice safe measures. So you're encouraged to do so. Don't resist having your temperatures checked. And these are all there designed for your safety and your protection. We continue with this together as a community, as a country. And remember, if we don't follow the simple things, then we have to prepare ourselves for drastic measures. Nobody really wants a prolonged and sustained lockdown, because the vast majority of our population will not be able to manage during a prolonged lockdown. Too many of our citizens are struggling financially and don't have the resources that are needed to survive a prolonged lockdown. Many of us do have our internet working, our lights working. We have all the utilities. Many people have Netflix and all kinds of things that they could entertain themselves with at home. You have computers that you can go online, do shopping, you can browse, you can watch movies, you can conduct your business. But the vast majority of the population do not have that kind of facility and that luxury. So to lock down really would basically ask these people to choose between having a meal and having a life that they can actually feed their children and look after their families versus getting sick coming out of the house. So it's very important for us to avoid these drastic measures that can sometimes become necessary. And if we do the right things, we may be able to prevent the country and the community from going into these drastic measures. Some people have a full pantry. They have stocks to last, food in the cupboard and the fridge, but many of our citizens do not have those resources. And these are people that we have to continue to be protective of, and we have to continue as a society to be mindful that not everyone has the same type of resources and not everyone can afford a prolonged lockdown. As we get more and more into 2021, our biggest goal now, as it stands now in April 2021, is to get as many persons in our population vaccinated. Now, there are two ways in which people can develop immunity to these viruses or any infection, really. One is what we are practicing now, which is to get vaccinated. But the other one is to actually get the infection and survive the infection. Not many people want to have the real infection and survive the infection, because you may not survive the infection and you may be admitted to hospital and you may get really, really sick. And if you ask a lot of persons who would have had COVID-19, there are still a lot of lingering effects that these people suffer from. Not just physical effects, but also mental effects. People are depressed, people are suffering from anxiety, they can't sleep, they have flashbacks, especially if they're admitted to hospital. So that is one way of developing immunity, by actually getting the disease and surviving it. The other way is what we are aggressively pursuing now, which is to do a vaccination program. And if we are vaccinating people, then we stand a better chance for the majority of the population to achieve what we call herd immunity. Herd immunity is when a certain percentage of the population has antibodies or defense mechanisms against the virus. And so we are able then to be exposed to it but not become sick from it. And so if many persons have that same experience, the hope is that the virus will naturally die out in the environment, because it actually does require humans to survive and pass from one person to the other. And this is the way that we can beat it. This is the way we can fight it. If everyone gets vaccinated, then the virus has a less chance of surviving in the community, a less chance of causing havoc and causing death and mayhem among those that we care about. So I want to encourage everyone that has the opportunity to get vaccinated to do so, and choose wherever you want to go. The best place usually to get vaccinated is the facility closest to you, where you live or where you dwell, where you go on a daily basis. If you were to check in the newspapers, online, there are all kinds of ways that people or the Ministry of Health and the authorities have tried to educate people as to where they can go and get their vaccines. Go to the nearest place, take the vaccine that is available there. We're probably not going to be getting the Pfizer or Moderna vaccines which are available in North America right now. We're probably not going to get that in the very near future. It's possible we might get it later in the year. So we can't just wait for something else. We have to use what we have now, because we have a fairly good record of safety and effectiveness. And so I want to encourage everyone who has the opportunity to take the vaccine that you should do so. The only people who should be cautious or not take the vaccine are those who have severe allergic reactions to vaccines in the past, or those who have a known adverse severe reaction to any component of the vaccine. If you have allergies but you've never been to hospital because of allergies, you're probably not someone who has severe allergies. So it's important for us to differentiate severe allergies from mild allergies. The severe allergies are those people who end up in hospital, end up needing help to breathe, need adrenaline injection, etc., getting into the ICU. If you don't have that type of allergic history, then it's very likely that it's safe for you to take the vaccine. So I hope that this would have encouraged my fellow citizens and residents to take your vaccine. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thanks once again for joining me.